Good morning, everyone. Today we're going to talk about diabetes. And the reason we're doing it is because November is National Diabetes Month. And what a time to talk about diabetes when we got Thanksgiving week here. When we got Thanksgiving here, where we're going to eat all these meat carbohydrates, potatoes and rolls and stuffing and gravy and pie, which is all stuff when diabetics have to really watch. And that whole table of goodies we had this morning, very tempting to diabetics, but they really have to watch it. So diabetes is a chronic condition. It results from body not producing or properly using insulin. Now, insulin is a hormone that works, it converts the sugar we take into our body into glucose, which we need glucose to get everything to our other systems. So a little history. It's classified as a metabolic disorder, which means it has something to do with our metabolism. That's what metabolic means. And blood sugars usually the levels we have checked when we go for our physicals over a long period of time, and blood tests can do that now. I was in nurses training back in the 60s. None of this was available back then, believe me. If you had diabetes, you had one choice. You have insulin, and that was about it. And there wasn't all the educational stuff available. So I have some nightmare stories of dealing with diabetics when I worked in a nursing home and stuff. But race, ethnicity, can't say that, and having a close relative with the disease can be causes. Now it goes back as far as an early Egyptian manuscript from 1500 BCE held the first description of diabetes. And this is what it said. It was the disease was too great emptying of urine. The term diabetes was first coined in 230 BCE. Now, diabetes is a Latin term meaning to pass through. An early Greek physician called the disease diarrhea of the urine. Another early cause of the disease was considered to be from moisture and coldness. Now, there's two different types of diabetes linked very early to Indian doctors. One was the youth type, and the other was they considered it just strictly from being overweight. The term mellitus, which is now diabetes mellitus, which means from honey, because excess sugar had been found in the blood and urine in those who had the disease. It was not until the 20th century when treatment was developed by the Canadians Fred Banting and Charles Best, who separated and purified insulin in the 1920s. Our pancreas converts our sugars into insulin, which we need, which I said. But so there was no way until way back in the 20s that they found out we could manufacture artificial insulin. The NPH insulin, which is used today and which is more of a longer term, was not developed until the 1940s. So you can see when I was in nurses training in the 60s, a lot of this was still pretty new. So in 2019, diabetes was the 9th leading cause of death in the US. Now just think about that. Now we've had treatment and we still have 9th leading cause of death. It is a group of diseases that affect how our bodies use glucose. Glucose is vital to our health because it provides energy to our muscles and our tissues and is the main fuel for our brains. Glucose is a sugar which comes from the food we eat. The food that we eat, whether it be carbohydrates, are converted into sugar. Like one of the examples we'll see, I have a little video for you. The doctor explains how a bagel. We don't think of bagel as something sweet or a sugary substance, but the carbohydrates convert into sugar, and we need that. Glucose, it turns into glucose, which glucose is vital to our health because it provides all of that energy, and it comes from the food. That sugar is absorbed into the blood where it then enters the cells with the help of insulin. So that's how it converts, our pancreas converts it into glucose. It's into our our bloodstream, and that's how we get the energy for our muscles and our tissues and our brain. The blood carries the sugar to the liver. The liver then converts it to glucose. When glucose levels are normal, our liver breaks down the stored glucogen into glucose to keep our levels normal. So when we have more than we need, then it's stored in our liver as glucogen. So what is insulin? Insulin is a hormone which is created in the pancreas, which is a gland just below the stomach. Insulin is released when we have just eaten and the glucose in the bloodstream is high. Now that sounds pretty good, right? What's the problem? It works by stimulating the uptake of glucose into the cells, which then lowers the blood sugar. So it's an automatic response. We eat, the liver, we get the glucose, and actually, I don't know how many of you ever feel like after you eat something really sweet, like you get almost like a buzz, and then your body starts converting it, or the insulin kicks in, and then our blood sugars kind of return to normal. So it figures like, oh, okay, where's the problem here? The liver and muscles can take up glucose for immediate energy, or they store it as glucogen. After we eat, our intestines break down carbohydrates from our food into glucose. It's actually a type of sugar. Our bodies make and release insulin in a feedback loop based on our blood sugar. The way you can kind of think about it is kind of like our heating and our air conditioning, our homes. You know, we bring in the cold air and it converts it. We need it in the winter, it converts it to heat, and in the summer, it'll convert it to air conditioning. That's kind of what happens in our bodies. High blood sugar stimulates the pancreas to release insulin. That sounds pretty good, doesn't it? Because we supposedly all have a pancreas. Well, the problem comes when we take in too much. We start overworking that pancreas. Pretty soon that pancreas says, you know what, I can't do this. I can't keep up with as much sugar or carbs that are taken into the system. And that's when we develop the problem, because our pancreas kind of like shuts down. It just can't be overworked like that. You know, it's similar to any other fight, like if our liver gets, we drink too much and our liver gets overworked, you know, we get cirrhosis. So that's kind of what happens if we take in too much sugar and all of a sudden our pancreas says, no, this is too much, I can't keep doing this. High blood sugar stimulates the pancreas to keep increasing this insulin. Low blood sugar promotes a different bunch of cells in our pancreas to release a different hormone called glucagon. Insulin and glucagon alternate to release to keep our blood sugar normal. Insulin shocks happens in a diabetic if you don't treat your dropping blood sugar as soon as possible. Now, people that have diabetes, they can kind of feel when their blood sugar starts to fall. Or if you notice you're with somebody and you know they're diabetic and all of a sudden they're acting kind of strange, they probably need some sugar. And the old thing we used to always give was, you know, we'd stir a teaspoon of sugar into orange juice and give them orange juice. That was now, there's different methods of doing it, but it's the same idea, to get sugar into you as soon as possible. So that's when you have low blood sugar. So insulin shock happens in a diabetic. If you don't treat the dropping blood sugar, the brain stops. If the opposite happens, blood sugar is too high, you need insulin immediately. Now, like I said, back when I was in nurses training and a first nurse, all they had was insulin that you get like maybe once a day. You didn't have this where you could check your blood sugar, where you had an insulin pump that worked. None of that stuff was available. So you had to watch your diet all day, because if all of a sudden in the afternoon, you know, you were going into diabetic coma or insulin shock, it was kind of hard to keep track of that. And what happens if you don't treat it? There's some serious complications, which we'll talk about in just a little bit. So when you need insulin, if that pancreas has quit working, you're in trouble. So the same things can happen in either one, insulin shock or diabetic coma. You can start having seizures, you can go into a coma, and you can even die. So that's how serious it is. So the symptoms of low blood sugar, you get shaky, you get dizzy, you get a fast pulse, you start perspiring, you get extreme hunger, nausea, weakness, blurred vision, headache, and numbness in maybe your lips or your cheeks. Now, symptoms of high blood sugar, thirsty, you start urinating a lot. You have fatigue, nausea, vomiting, shortness of breath, stomach pain, fruity breath, dry mouth. And one of the ways when I worked in the nursing home, that we checked if somebody was in, because a lot of those symptoms can be pretty similar. So if we had a diabetic and they were having things, one of the main things we checked was their breath, that fruity breath, if they were in insulin shock or diabetic coma. Because sometimes if you don't, the person can't tell you what they're going through. So there's different types of diabetes. The type 1 is usually referred to as juvenile diabetes. And the cause of that is really mystery. And what happens in little kids is, and it can happen a little bit later, but it's more usually in little kids. The immune system, which normally protects us, ends up attacking the insulin-producing cells in the pancreas. In fact, it attacks it to the point that pretty soon there's no insulin. So, kids, when this happens pretty suddenly, the parents really a lot of times don't know what's wrong with them. These individuals need artificial insulin in order to survive. So these people are dependent on insulin. Thus, these insulin pumps and everything that they carry now are they're such a help, especially kids. I recall when I was working on the pediatric unit, we used to get diabetic kids in. And those were in the days when you ate a tray and you carried it out and put it on a cart. I'm sure a lot of you might remember that. And these kids, because it's hard to explain to a 40-year-old that they can't have those desserts like we're on our table today. So they'd sneak out in the hall. If anybody left anything on their tray, they'd be sneaking it because, they wanted it. They were craving it. I had a nephew who was diabetic, and they literally she had to lock up the sweets and stuff because at night he'd get up in the middle of the night and he'd scrounge around for anything sweet to eat, the chocolate chips, so it's really difficult, especially back then it was. And it's hard to explain to a child, I'm going to give you a shot every day. Kids like shots. If you have to tell a little kid, yeah, every day we're going to have a shot. They don't go, hey, yippee, So it's difficult. The onset is sudden, and it can occur at any age, but usually they're young. The child may complain. These are some of the symptoms leading up to it: a tummy ache, low energy, and he urinates a lot. And a lot of times they suddenly lose weight. So we're going to talk mostly today about type 2 diabetes because we're all adults here. Type 2 is adult onset, and the symptoms are more gradual. The onset is gradual. A lot of times people don't really even know that they have a very serious illness. And the only way you can really tell is to go to your physician and have a blood test. The body is still able to make insulin, but insulin secretion is reduced. This is when your pancreas starts objecting and saying, I can't keep doing this. Your cells become resistant to insulin. Your pancreas is unable to keep making up for that resistance. Sugar then builds up in the bloodstream. Obesity is strongly related to this type. Genetics, as well as lifestyle, characterized by stress, lack of physical activity, and poor diet are contributing factors. And this onset, like I said, happens gradually. When you think of foods that maybe as an adult we should or shouldn't eat, like I said, when you look at that table we had today, that would probably all be. So long-term complications. One is neuropathy, which is nerve damage. And a lot of times people feel like their fingers are cold all the time, or their feet, or they start getting what we call foot drop, and we see that a lot in the nursing home because they could be in bed quite a bit and they get foot drop. Excess sugar can injure the walls of the tiny vessels that nourish these nerves, and that's what happens, especially in our legs and feet. This causes tingling, numbness, and pain from the toes on up. If not treated, you can lose all sense of feeling in your limbs. You develop gangrene and amputation if not treated. And I'll tell you, when I worked in the nursing home, I saw gangrene, and it's not pretty, and it's very painful. And As nurses, when you have to treat it, it was horrible because it's literally like your toes rotting off. It's terrible. And I also dealt with people that had amputations from untreated diabetes or from just not paying attention to your diabetes. It can also cause erectile dysfunction in men. There can also be cardiovascular disease, increasing the risk of heart attack or stroke by narrowing the arteries. Kidney damage can occur, and that's, our kidneys are mainly supplied with blood supply, so of course it could cause damage to the kidneys, which in turn, if it's kidney damage, you start getting pain across your lower back. Eye damage, loss of vision, increased risk of cataracts and glaucoma, foot damage, hearing impairment, depression, Alzheimer's, and dementia have also been associated with diabetes. Some of the signs and symptoms: increased thirst, increased urination, increased hunger, unprecedented weight loss. Even though you've been hungry and probably eating more, you start losing weight. Now, some of us go, ooh, but if we're losing weight and not trying, that's not a good sign. You go to the doctor and they say, have you had any recent weight loss? I always go, no. And he'll say, that's a good thing, and it is, because it could be a sign of something else. It can also cause being overly tired, slow wound healing. If you get hurt and the wounds don't heal right, that could be a sign. Itchy skin, blurred vision, skin rashes. If you have any of these, have it checked out. It's worth it. I don't know. I hope everyone gets yearly checkups. Usually we have in this day and age for any kind of medication to get an update. But a lot of times, when people start getting symptoms, they kind of avoid the doctor because it's kind of a denial thing. If I don't know, it really isn't. But the truth is, if you got these kind of things, have it checked out. Because believe it or not, even though it sounds grim and dismal, and it sounds like, oh man, it's chronic, when am I ever going to get rid of it? You're not. There's no cure for diabetes. But with help, you can live a long, productive life. You don't have to throw in the towel and say, I'm going to die anyway, so I might as well eat a whole chocolate cake, So the disease management part is to monitor your blood sugars, take your medication as prescribed. Now they have oral medication when you're pre-diabetic. You can start taking medication orally. That was not, when I was in nurses training, that was not a thing, that was not an option. They had not developed any medication orally. The only thing was to take insulin. And then we were real limited to even, when I first started, we only had one kind of insulin. Now I can't remember if it was 4 or 2, but one of them. And everybody was so happy when they developed the second kind because it gave people another option. Because some people couldn't take pork, they could take the beef insulin, and vice versa. So those kind of things are all things that have developed through the years that really, and if you think about it, you think, well, 1940 to now is a long time, but it's really not in the face of medicine, how far they have come. So yeah, there's very treatable things for diabetes right now. So monitor your blood, take your medication, and get your blood tested as regular as possible. Back in the day too, the only way that we could check if people had sugar in their urine, we had a little stick and you drop it in their urine, Now you do that little finger pokey thing, and so all those things are all something that has been developed in the last years. So it's a big help to diabetics. Living with diabetes takes work, and it can take a toll on you. I know sometimes people get real tired when they're diabetics, and they just get tired. So I have to keep doing this. And especially like for kids that have adult onset, when they get to be teenagers, you can imagine how hard that is. All your friends are going out for pizza, and they're going to birthday parties, and you have to watch whatever you eat. And it takes a toll. Pretty soon you want to just throw in the towel and say, this isn't worth it. But in the long run, it really is. So you can live a productive life. And there's not a one-size-fits-all. Somebody that has diabetes maybe says to you, "Oh, take this pill," or "Oh, use this." One size doesn't fit all. It has to be a program that's geared to you. diabetes managers, in addition to your physician, and they help you with diet, they help you with cooking, all those things. They tell you what you can and can't eat, how much, and there's no such thing. It used to be true that diabetics were restricted. You do not eat sugars of any kind. You do not eat cookies, cake. Now it's everything in moderation, and you figure it out all on your counts and all that kind of stuff. So it's very manageable. So you get a diabetic manager, and they help you through all that. Follow your doctor and the manager's advice. Learn all you can about the disease. You don't need special foods, just learn how to watch your carbs. Stay active, that's an important thing. Exercise. And join a support group if you can. Do not wait. Start today to take care of yourself. And now I got about a 20-minute video that I'm going to show you. A doctor is going to talk to you all, and then when we get done with that, if anybody has any questions, I will try to answer. Or we really have an expert in college, Jolene wrote a thesis on diabetes.
All right, well, we will get started. Hello and welcome again to another Move with the Doc Talk. Just to introduce myself, I'm Dr. Rupa Shah. I'm a board certified family physician and a health and wellness coach with over 20 years of patient care experience. So as we've done previously, I'll just chat with you today about some diabetes talk, and just feel free to move, stretch, get down on the floor and do some good stretching, to kind of loosen up those muscles. Or it's a beautiful day outside, and if people, if you're walking outside, yeah, just get outside and move your body as we talk today. So we're going to talk about something today that most of you have heard about, or even know somebody, or maybe you yourself have a diagnosis of, and that is diabetes. Specifically, I'm going to focus mostly on type 2 diabetes today. I'm going to mention type 1 diabetes, but the focus is on sort of that adult onset type 2 diabetes. This is a diagnosis that I, of course, see in the office quite frequently. And in a lot of cases, it can be preventable. And so that's kind of what we're going to talk about later in the talk today. So let's just, start out. What is diabetes? So at its core, what I want you guys to know is that at its core, type 2 diabetes is all about insulin resistance. So that's kind of the buzzword, the key phrase I want you to take away: insulin resistance. So what does that mean? The body does not respond properly to insulin, and your blood sugar will rise, okay? So this high blood sugar then over time is just not great for our body and all of the different organ systems. So specifically, it'll start affecting the heart, your kidneys, your eyes, the nerves in your extremities, your feet, wound healing, all those types of things from that really, really high blood sugar over the years will start having a really poor impact on your health. So how does it begin? And remember, the key phrase was insulin resistance. So what does this mean? So insulin is a hormone, okay? And it's made by your pancreas. And that's where it acts like a key to sort of let that blood sugar into your cells and allow your cells to use that blood sugar for energy. But in type 2 diabetes, your cells don't respond normally to the circulating insulin that you have, that your pancreas is making. So what does your body try to do? It'll try and make more. Your pancreas will say, oh, I just need to keep making more and more and more insulin because I see this blood sugar rising. And eventually, I sort of refer to this as your pancreas just like burning out. And it can't keep up. It can't keep up with the demand. The blood sugar starts to rise, and then this sets the stage for prediabetes and then eventually type 2 diabetes. So let's just pause for a moment and just think about that. So it's a state of insulin resistance. It's a state where people actually have a lot of circulating insulin. Insulin is not the problem here with type 2 diabetes. It's just, it can't keep up with the demands of your body. For instance, the foods that you're eating, or if you have a larger body weight, you're requiring more insulin from your pancreas. I just want to briefly contrast this with type 1 diabetes. So type 1 diabetes, or often referred to as juvenile onset or seen more often in children, is truly an autoimmune disorder. So it's very different. The body has actually decided to start making antibodies against the insulin. So it's not, it's not an issue where there's all this insulin. It's that the body is producing antibodies and the insulin is just not there and effective to be able to be used. And so therefore, those patients need to inject insulin because their body can't make it. So again, this is not the case in type 2 diabetes where there is lots of circulating insulin. It's just, again, your body isn't using it effectively. So now that you know that it's all about insulin resistance and your pancreas not being able to keep up with the demands, let's talk about what some of the signs and symptoms could be. And it's really important to realize that because it starts so slowly and can take many years to develop type 2 diabetes, a lot of people won't have any symptoms at all, okay? And that's why it's really important when you go to see your physician or your provider for your physicals that one of the tests you get done is a fasting blood sugar, because sometimes that can be your first clue that you're developing that insulin resistance, okay? So a few of the symptoms you might notice, and you've maybe heard some of these before, but going to the bathroom a lot, increased urination, feeling thirsty. Maybe you're noticing weight loss and you're not even trying. That's not okay. That could be a symptom of type 2 diabetes. Dry mouth, blurry vision, fatigue, just feeling really kind of tired. And I know that's really a common symptom, but if you are having that, it's worth getting your blood sugar checked. If you're starting to notice any numbness or tingling in your feet or any funny sensations, another good reason to get checked out. Or in general, for especially for women, if you're noticing more urinary tract infections or yeast infections than you've had in the past, just get that blood sugar checked with your doctor, just to be sure that that's not, an early sign of diabetes. Again, I've talked about it before, but it's a really simple blood test. It's what we call a fasting blood sugar. Fasting means you should not have had anything to eat or drink for at least 10 to 12 hours. That makes it a really good, accurate fasting blood sugar. There is another test called a hemoglobin A1C, which also can be helpful in the diagnosis. And typically we use a cutoff of 6.5%. It's sort of resulted in percentage values. And anything above 6.5 is considered abnormal. Anything between the 6 to 6.5 range, I consider pre-diabetes, and we start having talks about what we can do to prevent getting diabetes. So let's move on to what are some of your risk factors for developing type 2 diabetes. Some of these are going to be quite obvious. Again, if you have pre-diabetes, you're going to be predisposed to getting type 2 diabetes. If you are overweight, anyone actually over the age of 45 is more at risk. If you have a family history, so if you have a parent, a brother, a sister, grandparents, or just a really strong family history, make sure this is something you're getting looked at each year at your physical. If you're physically inactive and you're not moving more than 3 times a week, here's a really important one some women don't realize. If you've ever had gestational diabetes, that means if you had diabetes during any of your pregnancies, or if you gave birth to a baby who weighed more than 9 pounds, so those are really big babies, there's some thought that those women may have had gestational diabetes, and that does place you at a very much higher risk of developing lifetime type 2 diabetes. And then if you're from one of these high-risk groups, African American, Hispanic, Native Americans, or Alaskan Natives, and then also any Pacific Islanders or Asian Americans are also seeming to be at higher risk. So if you do fall into any of those groups, it's also a great idea to get checked out. So, and the physical exam is usually the best time to do this because that's a lot of times where you're getting some of those other maybe cholesterol fasting done, thyroid testing, other things like that. So let's say that you are sort of listening and you're like, oh, I have some of those risk factors she just mentioned, and it also runs in my family. So I don't want to get diabetes. What can I do? So let's talk about some of the things that we can do to prevent getting type 2 diabetes. And I do believe that, in fact, most people can make lifestyle changes to avoid getting type 2 diabetes. Now, that's not always the case. There is a strong genetic component to it, and sometimes these things aren't going to work. There is also a latent onset type 1 diabetes. I don't want to get too much into it. It's called LADA. It's sort of a hybrid of a type 1 and a type 2, and it does affect older adults who are thinner and have a different body habitus. And that's sort of a different category. It's a little bit more rare. And those folks do typically end up needing some insulin to get treated because there's a little bit of a component of an autoimmune, but also with that really strong insulin resistance that we talked about with the type 2 diabetes. So, but let's get back to just strict type 2 diabetes and how we can avoid it. So first, and probably the most important, is cutting out sugar and those refined carbohydrates from our diet, and basically just reducing the amount of processed foods that we eat. So when you eat those foods, okay, so let's say you eat a candy bar or even like a bagel, okay, so those that food gets immediately broken down into all these small sugar molecules, because carbs in essence are sugar molecules all linked together, okay? And then that all gets absorbed, all that sugar gets absorbed into your bloodstream and your blood sugar rises. So your blood sugar rises, your pancreas recognizes this and says, okay, time to make some insulin. That's that, again, that hormone that helps get that sugar out of the bloodstream and then moves it into your cells again, okay? Now, in people with prediabetes, the blood cells, again, we talked about, are going to be a little bit resistant to the insulin action. So the sugar is going to stay high in the bloodstream. So if we then measure the blood sugar an hour later, we're going to see it still pretty elevated above what a normal person's blood sugar would be after eating. So again, to compensate, the pancreas produces more insulin, trying to, again, keep bringing that blood sugar down to a healthy level. And then over time, as we said, it's going to lead to higher blood sugars, higher insulin levels until we finally develop type 2 diabetes, because the pancreas is like, you know what, I can't keep up. I can't keep doing this because this person continues to eat these foods that are really stressing, this organ. So lots of studies have shown the link between frequent consumption of sugar, refined carbs, and the risk for type 2 diabetes. So if you can replace them with foods that have a less of an effect on your blood sugar, you're going to help reduce that risk. So what are you going to replace it with? So healthier options, and usually this is going to be foods that are higher in fiber. And we've talked about this, I think, a little bit in the gut microbiome talk, and just talking about how important fiber is in our diet, especially in American typical diet. So we know, again, how important fiber is for weight management, for our gut health, but in studies in elderly folks, obese individuals, and pre-diabetic individuals, fiber has been shown to keep the blood sugars and the insulin levels lower, and thereby reducing the risk of developing type 2 diabetes. So again, fiber, we have insoluble fiber and soluble fiber. Soluble fiber, you absorb that water. Insoluble fiber, you don't. So in the digestive tract, the soluble fiber and water form kind of this gelatinous material, and it slows down the rate at which food is absorbed. So this leads to that really gradual rise in the blood sugar instead of that huge spike that you get. Like if you were to eat a bagel, it's going to be a huge spike. But if you ate yogurt or something different, you're going to get a gradual rise in your blood sugar, and that's what we want. Insoluble fiber has been linked to reductions in blood sugar levels, decreased risk of diabetes, even though we're not exactly sure how the insoluble fiber may work, as well as the soluble fiber, but both are good. So you want to add more peppers, mushrooms, vegetables like asparagus, broccoli, spinach, all that fibrous food. Fruits. Fruits are tricky. Certain fruits are very sweet and do have what we call a high glycemic index, and you can find these lists online. you want to choose even the fruits that have what we call a lower glycemic index, so they're not going to hit your system and help or make your blood sugar rise right away very quickly. Protein, also very good. Fish, chicken, turkey, tofu, eggs, really good sources of protein that are going to lead to a very gradual rise in your blood sugar. That's what you want. A lot of talk you always hear about whole grains. So whole grains, things like quinoa, brown rice, steel cut oatmeals. When you eat these foods, it's harder for your body to break it down. And it takes a little bit longer to digest. So you don't get that spike in the blood sugar. It's a gradual rise in the blood sugar. And then of course you want to choose more water, unsweetened beverages. You don't want to drink a lot of sugar. And I will even say alcohol and wine. Red wine is nothing but, just an adult fruit juice that's really going to cause those sugars to spike as well. And then lastly, as we're talking about diet, just watch your portion sizes. Eating just too much food, even at one time, really can cause higher blood sugars and have your body try and produce more insulin to deal with that, okay? Second big category, if we're trying to prevent diabetes, is going to be exercise. Now, exercise is good for lots of things. So I'm not going to get into all that and how it can control your weight and stuff, but we know that exercise independently can improve what we call the insulin sensitivity of your cells. So yes, your cells can be more or less sensitive to insulin. So when you exercise, less insulin is actually going to be required to keep your blood sugars under better control. So that's actually very cool. One study, people with prediabetes found that kind of a moderate to intense exercise increased the insulin sensitivity by 51%. And if you did high intensity exercise, it increased it by 85%. But that effect was only then kind of lasted on the days that you exercised. So many types of physical activity have been shown to reduce insulin resistance and blood sugar in overweight, obese, and pre-diabetic individuals. So any type of aerobic exercise, high intensity interval training, even strength training can improve your insulin sensitivity. So again, I think the bottom line is that working out and exercising is going to improve your insulin response, your cell sensitivity to the insulin that you already have circulating. And so I would avoid being sedentary and just try and keep moving. And then last, I do think it's important to, say this, even though it's sort of a little bit obvious, but if you are overweight, working on that weight loss is going to be important at reducing your risk of developing type 2 diabetes. Again, I do want to stress, not everyone that's overweight is going to develop type 2 diabetes. And there are, again, those folks that aren't overweight and they do get type 1 diabetes or that latent onset diabetes. But most of the time, people with prediabetes tend to carry that excess weight in the midsection, which also means that weight or that adipose tissue is surrounding your organs, things like your liver, your pancreas. We call this visceral fat. And we know that that visceral fat is linked to more inflammation overall in the body, and then insulin resistance. And again, what did we say type 2 diabetes was all about? It's all about insulin resistance. So this, again, significantly having that excess body weight, that visceral fat, is going to increase your risk for type 2 diabetes. But the good news is that even just a small amount of weight, it doesn't have to be a lot, a small amount of weight is going to have a profound effect and help reduce that risk. So they studied 1,000 people with prediabetes and found that for every, even 2.2 pounds of weight that people lost in that study, their risk of diabetes reduced by about 16%, and the maximum reduction they saw was 96%. So it doesn't have to be an overwhelming thought of I have to lose 15 or 20 pounds. You certainly don't have to. Again, it's sort of like when we talked about hypertension, even just a modest reduction in your weight is going to improve those key parameters and help you get your cells more sensitive again to the insulin and help reduce that risk of diabetes. So don't get caught up in how much weight it has to be. It doesn't have to be. It's just small incremental reduction in your weight. So one thing I just wanted to mention really quick as we were talking about insulin resistance, let's say you are falling into that category and your doctor has told you you know, you're pre-diabetic, your blood sugars fasting are above that 110, I'll usually say 110 fasting is usually considered pre-diabetes. So let me back up. So between 110 and 126 is usually that pre-diabetes, okay? Above 126 is usually the cutoff that we use to say, now you meet the criteria for having type 2 diabetes. So keep in mind that 110 to 126 is pre-diabetes. If you fall into that category and your blood sugars every year at your physical have repeatedly been in that range, you can talk to your doctor. There are medications that we can use for folks who aren't diabetic but are pre-diabetic, and metformin is still one of the tried and true really great medications. In fact, I'll talk to my patients about that. We don't want to wait until people have type 2 diabetes. There are things that we can do, and we already talked about them: changing your diet, exercising, working on the weight, and I will say certain medications like metformin, and there's some newer ones now out on the market. So talk to your doctor, but the first thing is getting in for your physical and getting those blood tests done so you can see where you fall on that. So diabetes, unfortunately, is becoming more and more prevalent in our society in adults, and then unfortunately also in children, adolescents, teenagers. So we're starting to see more of it. But the good news is, I hope the message today was that you have control over this. For the most part, of whether or not you develop type 2 diabetes. So I hope you've learned a little bit about diabetes, what it is, signs and symptoms, and then the key phrase again, it's all about that insulin resistance, and that's what you want to focus on reversing. So if you have any questions, please put them in the chat, reach out to me via email. I love that too. People have done that in the past. That's really great. Rupa.shaw at ssmhealth.org or .com, sorry. So feel free and reach out. I'm here if you have any follow-up questions or concerns. Thanks again for joining in, and I will see you next month.